Hello and welcome to the Future of Health Summit in association with Forbes Africa and Philips. My name is Nozipho Shabalala and it's my pleasure to serve you as your moderator today. Now, we kicked off this virtual conference yesterday under the theme Looking Beyond the Crisis, how healthcare leaders can learn from the past to build a resilient future. Now, some of the pertinent issues already discussed yesterday included the generational divide in South African healthcare and how we might reconcile the needs of healthcare leaders and the expectations of the next generation. Of course, there was also considerable focus on how we might create a sustainable healthcare system for today and for tomorrow towards one that is delocalized and values-driven. And of course, we also spent time looking at the all-important issue of healthcare information, which we know is particularly relevant today. And so we turn our focus to this evening, where we're going to be focusing on how the healthcare sector might leverage and apply lessons from digitally led sectors and what that may mean for the future of health. We're going to kick off today's sessions with a fireside chat with Professor Richard Gordon, and this is moderated by my colleague Renuka Methil, who is, of course, the managing editor for Forbes Africa. Renuka, it's over to you.
Thank you so much, Nozipho. Loving the fact that you're in the studio today. It's lovely to have face-to-face interactions finally. For a healthy economy, you need a healthy population, and for that, you need robust healthcare solutions. You need research, you need innovation, and more importantly, capital injections so that everyone has access to quality medical care. How can we make this a reality? Joining us now to answer this question is
Fireside Chat with Professor Richard Gordon, Director of International Partnerships for the South African Medical Research Council.
A warm welcome to you, sir, today. Let me start with this question. With COVID-19 highlighting a lot of the shortcomings in our healthcare systems, when you look into the crystal ball today, what do you think COVID-19 has really taught us? What is the new course of action, the new business model that Africa really needs in a post-pandemic world?
Hi, thank you very much for having me on the show. And that's a really complex question to get started with. So COVID's taught us many things. It's taught us that we're not prepared for pandemics. It's taught the world that there is massive inequity in the system. It's taught us that the supply chain mechanisms that the world uses are not working when they're already pushed to the limit. And it shows us that Africa really needs to be moving quite strongly towards thinking about sustainability and looking to try and take the lead in some of these areas. That's kind of the main themes that I would think be coming out of something, the last 2 years has really taught us. When the epidemic broke and travel was halted effectively, we all talk about access to vaccines now, but 18 months ago, we had the same dialogue around access to reagents, diagnostic tests, equipment to test people. So it's really showing up the faults in the current model of supply chain, not just vaccine. Everyone defaults to vaccines, but really it's across the board.
Take us to the early days of COVID-19, sir, when we faced the disruption of the very nuts and bolts of our healthcare services, when there was a shortage of drugs, equipment, like you said, diagnostic services. How have we now prioritized all of this? How are we working more closely in recalibrating our processes?
So I'm not going to lie. It was crazy. Last year, March, April, I think everyone in the world was kind of in the same boat. We didn't, from a disease perspective, no one really knew enough about COVID to be confident in what its long-term effects were. We didn't really know how lethal this was. We weren't really sure of the symptoms. Was this a lung disease? Was it a heart disease? And that will only really be borne out by time. So when we kind of went into lockdown, there were all these unknowns about the diseases. There weren't really tests for this pathogen around the world. They were kind of developed as they came. And basically, a lot of countries had to bootstrap their testing system. So in a South African context, we had a lot of the infrastructure and equipment to do the testing, but we couldn't get the reagents because no one was flying anywhere. And then when people were flying everywhere, the global power of the dollar and the different economies in the EU, we were put at the back of the queue effectively in many cases. And there are many examples of how that kind of transpired. But out of all of that came a realization that in many cases, and there are many organizations that took lead. I'm very proud to say the MRC were one of them, but the African CDC were another fantastic example of an organization that really took the lead in trying to champion on the science. So from a supply chain perspective, we might not have had vaccines and access to the medications that we needed at that stage. But what we were doing is we were being very active in leading a lot of the science. And you will see around the world, there's lots of programs around science, and the leadership of the continent has been really trying to be leading in. So we really focus on the science because that was our kind of mandate at that stage. And there were, we can come into that a little bit later on, but effectively, a very simple example in the South African context, just one of the projects that we were funding, it's been quite a topical one of genomic surveillance, but the analysis of data beyond that really dictated our vaccine rollout program and which vaccine we go for and which vaccines were likely to work in Africa, et cetera, et cetera. And that was really based on scientific research that was funded locally, which was really our core niche.
True. Science actually did take the lead. And 18 months later, there seems to be more optimism now and more cautious optimism, as someone remarked at the summit here yesterday. And there is confidence in the healthcare system, as the new Philips Future of Health Index revealed as well yesterday. But the need is for new data, new knowledge, new innovations, new research. How do you think we can strategically address the gaps and barriers in the health innovation ecosystem in South Africa? Professor, do you think we're lagging behind in some way?
So there are gaps, without question. I think that would be, I think a lot of countries would be in that boat. So if you're looking at South African example, and to many extents, a lot of institutions in Africa, there are pockets of excellence, but there are gaps between those pockets. So, for example, if we were trying to develop a lot of the fundamental research that you would have to go into developing a vaccine, that exists on the continent. But the product development aspect, which is the gap in between, didn't. So what that practically meant was that we were doing a lot of research, but we weren't translating that into homegrown innovations and products. And that's really, I think, been the mind shift change over the last kind of 18 months. So I am optimistic that a lot of the governments, particularly in Africa, are realizing and addressing it. And vaccines is a very good example of what the African CDC is looking to do and what the WHO is looking to do with their hubs. So it's not all doom and gloom in the sense of, this is going to be a disaster. I think there's been a lot of good that has come out of the last 18 months in letting the continent understand where the gaps are and then to go out to external partners and help us fill those gaps. I think the days of organizations just trying to outcompete each other just to get the next grant so they can fund their group, that kind of dialogue has changed quite a bit, where people are being a lot more collaborative, a lot more open access, because we have to. We can't be funding duplicate projects, or people are looking to collaborate a lot more. So there are definitely some positives, and those positives are really one of the mechanisms that we're trying to do to fill some of those gaps. And, I think in the vaccine space is a particularly good example of that at the moment.
Certainly, Professor, you mentioned funding, and you also talked about external partners and collaboration. We'll dwell on that later. But I just want to stay on the topic of funding. Now, there's been an increase in healthcare funding opportunities and forward-looking capital investments in the medical world in Africa. And I was reading a report the other day that the funding of health tech startups has increased by more than 250%. But what are the pros and cons and likely dangers of these capital inflows? Do you think it's not just about the money coming in, but how do we make sure that they're deployed well?
So I mean, that's a great question, and we could probably have a 3-hour discussion just on that question. So, I mean, the pros are, without question, the ability to build an industry, build a biotech industry in Africa. And when I say Africa, I'm not talking just SADC or Western Africa or Eastern Africa. We can't just service one part of Africa. This is a real continent-wide initiative. And that's why these entities like the African CDC and what they're seeking to do are really important. So without question, capital needs to come in and to help build the system, because typically that kind of capital on the continent hasn't really existed to a great extent. The challenge that it comes with, and I can see really two that are quite common. The first one is what I would like to call the not invented here syndrome, where everyone wants to do their own thing, and they don't acknowledge what exists in the continent already. So company X wants to come in and wants to establish this, and don't realize that a 1-hour flight away, there's actually something quite similar that exists, and just needs, instead of them putting in $300 million to set up a facility, they only need to have 30 if they just collaborated with an entity that existed. So I think this desire of international funders or partners coming in and seeking to do their own thing has to kind of really come to an end in the next kind of few years, and really build on what exists. So that is one, and it stems around duplication of a lot of the activities. The second one is similar to it, is resources. And if just a very simple, example of what's happened in the last, 2 months with the announcement of the vaccine hub with the WHO, then Pfizer's announcement with the vaccine manufacturer, then BioNTech doing announcement, Aspen doing the announcement with J&J, Moderna doing the announcement. That's fantastic news for the continent. But who's going to run these facilities, and where are these skills going to come from? So 1 or 2 of these facilities could probably be staffed by exalted capacity. So there needs to be a massive training program that goes into place to be able to upskill and develop the platforms so we can sustain these investments. So from my perspective, from where I sit, and putting all the classical ones like the IP discussions, the regulatory harmonization, which are relatively old discussion and are kind of being addressed. The newer ones are really around about, let's stop duplication of funders. Let's stop people wanting to do their own thing. And let's also focus on building the talent pool that's going to ultimately make these sustainable.
Building a talent pool, certainly, Professor. I'm going to also touch on the digital health technology that we all agree will feature prominently in this new paradigm that's emerging, and we've certainly seen COVID accelerating the uptake of telemedicine, mobile health clinics, AI. But what are the opportunities and challenges you see in the digital health space? You mentioned the skilling of people to accommodate these sectors, but what are the specific challenges and opportunities that you see, especially, if I may add, also in the communities and in the rural geographies, if we can get them involved in these innovations?
So digital health, without question, is going to be one of those technologies that can stand aside in Africa and have a particularly powerful role. When I really got involved in this digital health space, probably about a decade ago, I had underappreciated just how mobile technology had really been dominating the African continent. That it wasn't uncommon for people to have more than one cell phone, and how well people were connected with cell phones. So digital technology is definitely going to be a driver in the health sector in Africa, and link that with artificial intelligence and all the things that kind of go with it. So, but it's not a panacea, and it's not going to do everything. From the health systems point of view, I think it's got a lot of powerful applications. I think reaching remote communities, getting information to people who might need them. And the whole system about billing and financing, I think, has already been sorted. It does come with a couple of challenges, though. And the first challenge is around governance. Who owns the data on these kinds of platforms? Conceptually, developing an app or a digital platform is not that difficult. Most teenagers these days can develop an app, and it's not technically that challenging. Scaling it is the challenge. So I think the question around scaling and governance is important. The key question is sustainability. How are you going to sustain these platforms when they come involved? And the last point I'll make around this really stems back to the previous point about people wanting to do their own thing. I was in a meeting last week when they were talking about TB adherence apps in South Africa as a program that has been run. And at the latest count, we have 8 different TB adherence drug medication apps in South Africa, funded by different funders. Some work within one hospital, some work within a district, some work within one health system. So these are different funders who've come in, funded an adherence app. None of them connect with each other. And the cost of integrating those 9 apps costs more than each individual project put together. So I think digital health is really an important area where the funders need to come together with concerted strategies on how they want to do the space, because the danger is it's going to create a lot of noise, and people won't know the wood from the trees. So those are the caveats that come with it. But digital health, without question, can be truly transformational for the continent if done the right way. And if you think about it from a government's perspective, where if you could map the population and the demographics of the population and your platforms to integrate, that is very much the kind of the holy grail scenario that people want to work towards, that where government at any moment in time can look at heat maps of TB outbreaks, HIV outbreaks, linked with phones that are all on one platform that the data is live. At the moment, we're still a bit away from that.
Yeah, I think a very long way to go, especially for AI as well. Now, not just global collaborations, you mentioned external partnerships, but how do we bring about, firstly, the integration of the public and the private healthcare sectors? Surely we need an enablement from the private sector and an aligning of business models. Ultimately, it's for the better patient outcomes and placing the patient at the center. So how do we achieve that?
So that's a complicated modeling discussion between government, private sector to try and get the balance right. It's unfair to expect the private sector to enter into a partnership where they are unsustainable, where cash flow is an issue, where the typical kinds of things you hear is that doing partnerships with governments tend to be risky because they pay late and sometimes they don't pay, and then people move around and procurement changes, etc. Versus the needs of the public sector. If we can get those to marry together, where it's a win-win partnership, where it allows for long-term planning, and where the patient at the end of the day is the real person who benefits, but while keeping everything sustainable, I think that's the model we need to be moving towards. So it's not a quick fix. It's been a problem that's been around for a very long time, but I think parties need to come in with both of those kinds of approaches together. And I think that is definitely what's kind of happening. If you talk to the different departments in South Africa, whether it's Science and Innovation, Trade and Industry, Department of Health, Treasury, I think everyone is trying to align that, but it can be quite tricky with depending on the different aspects you're looking for, whether it's drugs or PPE or vaccines or you name it. But that is very much, I believe, the way that the market is looking to move, and the way for Africa is going to have to move to be successful.
So you've been very heavily involved in building capacity and innovation in Africa. How hard has it been mobilizing resources for the funding of clinical trials, if you could tell us from a South African perspective?
So there's 2 levels to answer that question. So at a clinical trial level, I think it's not been that difficult. And I say not that difficult. It has been difficult in the sense that a lot of funders don't part with tens of millions of dollars very freely. But when for something like COVID, there's been an urgency, and we've been very blessed to have a number of funders come to the fore. Our government came to the fore, Treasury came to the fore, a number of philanthropies, the Solidarity Fund, the Elmer Philanthropy, the Dell Foundation, they came in and everyone chipped in. So, and the answer to that is, you need money to do clinical trials. And that kind of allowed organizations like the MRC to be very successful in being part of a lot of clinical trials and all the vaccines kind of coming through and collaborations. That's at a kind of a COVID clinical kind of level. If you go to the grassroots level, I think there is still a gap that needs to be addressed by funders across the board. If you are, most people would not have heard of the big funders in the world, and most people would never have written a grant to some of those kinds those big funders. So typically the people that would usually quote would be the Bill and Melinda Gates Foundation, the National Institute of Health, the Wellcome Trust. Most people would not have heard of these organizations. They would have heard of Bill Gates, but they would not have necessarily heard of his foundation. Wouldn't know where to apply and look for those kinds of funding opportunities, but they have good ideas. And they have Africa-relevant ideas. And I think the trick really is getting that match and trying to find a middle ground where we can get access to those ideas which come from the non-traditional places, but in our context in Africa can have massive impact. Because they will be culturally aware, they will be society aware, they'll be culturally appropriate, society appropriate, which a lot of funders don't really think of as a first criteria. So that's at the lower level when you're talking about funding innovation. When I'm talking about the slightly smaller grants, but at a community-based level, they could make huge impact.
I'm going to move from funding and innovations to a very important topic, and it's unfortunately not talked about enough, and it is mental health, and more appropriately, the financing of mental health is a neglected priority in sub-Saharan Africa, especially with COVID-19 exacerbating mental health issues among the population. How do you think the scenario for funding, mental health funding will actually change? Do you see any improvement at all?
So talking from a South African perspective, I do. Being part of the Medical Research Council, we get to go to Parliament and present to parliamentary committees. Consistently for the last 4 or 5 years, mental health has come up consistently as a big issue that has been underfunded and under-researched. And mental health is a big topic. What we have seen in COVID times with the mental health aspects, it also relates to substance abuse, alcohol and drugs. It encompasses many different facets. So as a result, we did embark on a program in mental health as a result of our own government asking us to look more into this as part of a Newton Fund program, which is a collaboration with the UK and the South African government. And we have quite a large portfolio, and I say large, from having not many to having a handful of quite sizable grants looking at mental health issues. But that's just a drop in the ocean. If you look globally, there are some rather large funding foundations. The US government, the National Institute of Health, has a whole section dedicated to this. The Wellcome Trust, if I'm not mistaken, have got mental health as one of their new 3 pillars that they're looking to fund. That was not really on the radar about 18 months ago. So I do think the landscape is changing. Probably, I do think the impact of mental health is underestimated. And I do think the funding is likely to be moving into that direction very soon. South Africa has kind of been in a situation where it's all been dedicated to HIV for obvious reasons. We have a high disease burden, then TB, now it's been COVID. But mental health is one of those ones that is constantly becoming of high prominence. And I do think it's very likely it's going to be funded more significantly in Africa. But I think the onus for that really needs to come from the different government and funding institutions to be pushing that because it's an under-researched area globally.
Point taken, Professor. Surely there's quite a lot of work to be done, and unfortunately we have very little time. We've actually run out of time, but in closing, I want a parting shot from you. What is this bright picture that you would paint for a post-pandemic Africa?
So I would like to think that COVID has shown up the failures of the system, And I say the system, the global supply chain, whether it be drugs, vaccines, machines, reagents, kits. And I think the world is now working up to that. And we've now got a golden window, an opportunity to really take these things into our own hands. And within, 10 or 15 years, to be manufacturing our own drugs, manufacturing our own vaccines, manufacturing our own machines and kits, to become self-sustainable and be able to address our priorities as they arise, and not to go into the queue of the global supply chain in the future. So I think that is my crystal ball looking forward. I think there can be a lot of good that can come out of this if we build on the momentum, and it doesn't fizzle out over the next year, 18 months if COVID kind of becomes a thing of the past. So I think there's no time like the present for us to targeting a sustainable, functional Africa at the end of this pandemic.
So no time like now for a new course of action. That was Professor Richard Gordon, the Director of International Partnerships at the South African Medical Research Council. Thank you so much, and over to you, Nozipho.
Thank you so much, Renuka. It certainly was a fireside chat that has ignited the conversation, and I don't doubt for a second that we're going to be building on some of those embers. We're transitioning now to our panel discussion, which is really going to be an invitation for us to step out of the traditional understanding of healthcare as we begin to engage with emerging and future healthcare challenges on the horizon. And of course, our panelists are going to be looking at some of what the digitally dominant and digitally led sectors are doing, and asking the question, what if this was more deliberately integrated in the healthcare sector? Let's meet our speakers.
The panelists are Wayne Zuyas, CEO and founder, Basalt Technology; Dr. Nomisa Lithe Gilata, neurosurgeon and director of Santon Brain and Spine Center; Professor Alp Numanoglu, head of pediatric surgery at the Red Cross War Memorial Children's Hospital and University of Cape Town; Dr. Linus Wenda, founder and CEO, Medicines for Africa.
It's a massive welcome to all our speakers this evening. I'm going to get right into it. And Wayne, I was intrigued by some of the descriptors that are often used to describe you. You're described as a technology maverick and, of course, as a futurist. So maybe the first question tonight must go to you. That is, what are technology mavericks and futurists concerned with today as they engage with the future of healthcare?
Thank you for having me on the show this evening. There's a couple of points we could look at. And I think, firstly, the number of healthcare apps on iOS and Android in the last 2.5 years has doubled. So we're looking at more than 100,000 solutions just coming on mobile devices. So we can see the number of innovations and innovators coming to be, and really great solutions around there. What's really interesting is the information revolution. So this is the spread of connectivity across people in South Africa and Africa. And what this does is it gives everyone a ticket to play. So with smartphone usage, there's really massive opportunity in terms of sharing data between patients and providers and enabling remote treatment, which can be scalable. So that's really interesting that we're seeing and happening at the moment. But I think there's really great innovative solutions and visions such as remote surgery and diagnostics and all those exciting things. But I think what you come to realize is we need to start thinking before the future to get the basics right. And there's so many solutions that need to be solved currently in South Africa. There's just looking at simplifying the basic process of digitizing the endless paperwork in healthcare institutions, and how do we use technology to automate that and make that simple and streamlined so that healthcare workers and providers can focus on what they're good at and in the medical field instead of wasting valuable time there. And then, as the prof said earlier, that AI definitely one of those interesting things in coming into medtech, and as well to predict and diagnose diseases earlier. which is really, really exciting. And I think lastly, just on looking at one of the last points on this is evolving business models. And we see how many businesses are upgrading, changing, and revolutionizing the current model, and making the entire healthcare system more efficient and better aligning incentives across the board.
Wayne, I think it's an excellent start to the conversation. I certainly want to double click on this proposition that you put forward, that we need to focus on getting the basics right. But before I move on, you brought in some of the comments from Professor Gordon. And of course, when he was talking about some of the innovation that we're seeing in this place, he raised questions about the governance of some of these platforms. He raised questions about the sustainability of some of those platforms. I'm keen to hear from you, Wayne. What's your observation? Do you think that we're going to catch up on the governance and sustainability front, and right now it's all about supporting these apps and these platforms to try and do new and exciting and interesting things?
So I think, touching again on the point of private versus public sector, and one of the things that the pandemic has taught us is the private healthcare is just as reliant on everyone else, because virus and infection spreads throughout the population. So if people have been vaccinated or got that healthcare, hospital beds ran out, no matter who the individuals or what class or what their income was or net worth. So we need to look at a population in totality, and what are the solutions that we have around in our country for everyone, because everyone is affected when infection and virus spreads, as we've seen previously. There's a massive sobering stats that only 17% out of 100 South Africans have medical insurance, and 45 million people in South Africa fall outside of the medical aid net. So, there's a massive gap, and there's a lot of work and opportunities as well to be developed and fill those components.
Yeah, Wayne, that's certainly very exciting as we talk about potentially reimagining what access could look like on the back of technology. And maybe let me go to Dr. Hendwa next. Dr. Hendwa, one of the things that Wayne spoke about was going back to basics. I'm keen to understand from you, what does it look like to both maintain and innovate? What does it look like to ensure that you are building back better in terms of our health systems and maintaining those health systems, whilst at the same time looking forward and beginning to think about emerging opportunities and emerging challenges? What is your experience of this phenomena? Dr. Hendwa, I think you're muted. If I can ask you to kindly unmute.
That's better. Can you hear me now?
Absolutely. Please go ahead.
Great. Yes. So going back to the basics, I think, for us is, the thing that Wayne mentioned about data, the digitization of data in the supply chain management work that we do. We still see a lot of over-reliance on paper. A lot of the information is held on paper, which means that it's invisible to the system, and therefore which limits our ability to use that data for virtualization or for improvement. But just going back, we have a lot to be pessimistic about right now, but I do share the optimism that has been expressed by South Africans, because what I'm seeing is that we are emerging from this crisis with greater clarity of purpose and an unprecedented unity of purpose on what needs to be done for us to build resilient health systems and economies. And I'm going to tell you why. I've been having conversations, one-on-one conversations with many leaders across the continent. And what's really coming through from those conversations is the determination amongst our leaders that they are willing to do what it takes to tackle our health challenges. Now, what are those challenges that we have on the horizon? There are many, but I'm going to mention just three. First, we have lost more than a decade of health development gains in childhood immunization programs, access to treatment programs for ARVs, tuberculosis, malaria control due to service disruptions. And these reversals are coming at a time when healthcare needs of populations of South Africans and all over the continent are growing, and we're still meeting the existing ones. We're not investing anywhere near enough what we need to do to meet these needs. So the second challenge that really looms large for me is the challenge of access to healthcare services and to quality, affordable treatment. Treatment that is available when we need it, where it is needed, and with enough health professionals to support patients to actually get that care. And then the third big challenge, the one that we at Medicines for Africa and many of our leaders across the continent are currently seized with, is the question of how we reduce our historical dependency on security of access to medical products on others. So this is diagnostics, vaccines, pharmaceuticals, everything, medical consumables that we need to effectively deliver healthcare. And South Africa, indeed the rest of Africa, for security of access, we need to be able to effectively deliver healthcare. We need access to products. So on a continental level, we are seeing tremendous action to build healthy manufacturing ecosystems for medical products to bring that security of access to medical products. On a regional level, we are creating the necessary institutions to make sure that that ecosystem is healthy and it's maintained. The African Medicines Agency, the African Continental Free Trade Area, centers of excellence to drive medical innovation. So we're really seeing governments stepping up and recalibrating the market in a way that gives African manufacturers, the businesses, a share of the market that they have been historically denied. And investors are stepping up to build new facilities and expand existing ones. So for the first time in our history, there seems to be genuine realization that we cannot build resilient economies without securing the health of South Africans, without securing the health of Africans. So yes, we have challenges, and I'm seeing a lot of good things being done to meet those challenges. So I think there's a lot of reasons for us to be optimistic, to be hopeful in South Africa and on the continent as a whole.
Dr. Hendo, I think you've said so much in that response, and I just want to do a little bit of lifting up, because I think those insights are absolutely incredible. On the one hand, what I'm hearing you saying is that we're finally moving from conversation and we're beginning to see action on the ground. We're seeing a translation of political will into actual resourcing, both at the institutions that are being built at a regional level, the investments that we are seeing on the ground. The follow-up quick question that I've got for you, Dr. Hendo, is, are we doing good enough job about learning from digitally led sectors? And are we being deliberate about integrating technology so that even the gains that you speak about right now could be scaled, could be faster, could be accelerated? What are your thoughts on that?
So I think, this question of digitization, virtualization, it starts with data. You need a lot of data to be able to build those platforms in a way that you can actually build data assets that you can mine for information that can help you in decision making. So we have a serious problem with lack of data, and that limits our ability to plan, for example, in the area of medicines, to plan our supply chain management, our ability to consolidate our market and leverage our buying power. So, to start with, we need to fix data to be able to learn from other sectors, because the one thing that we can learn from sectors like the finance sector, the video streaming or movie streaming businesses, the aviation industry, what they have is tons and tons of data that helps them to actually understand the behaviors of people. But in this case, we're talking of data that allows us to understand the needs, the medicines consumption patterns, how we should structure our supply chain so that we can make sure that the medicines that a woman sitting in Khayelitsha can go and get their antiretrovirals, and they're going to be there for her at that health facility. So first, to be able to virtualize, to be able to even learn from other sectors, we need to start with the data. We need to digitize that data so that it's actually available in a format that allows us to get information that enables us to improve and become resilient. And so to optimize treatments for patients, we can have the ability to make the most optimal treatment decisions with that data, providing individualized care if a person have HIV, if they also have diabetes, what is the most optimal treatment combination you need to give them? And do we have that? Do we have a supply chain to make sure that is available? So I think for us to be able to really leverage and learn the lessons that we can take from other sectors, the predictive analytics, the machine learning, we have to start with building the foundation that Wayne talked about, the foundation of data engines that we can mine for information to direct us and inform us in decision making.
Dr. Hendra, thank you so much, because of course one of the biggest challenges that has plagued us in Africa has always been, one, the absence of data, but also the absence of being able to manage that data. And what I'm hearing you say is that it makes us ineffective in our planning. But I must say, what really excites me from what you've said is, as I think about Netflix as an example of a streaming service and how they've successfully leveraged data to get the right show on my screen at the right time when I should be watching. And of course, for me, the big question is, what if we had that amount of capability in the healthcare space and in the healthcare sector? But let me go to Professor Nomanoglu next before we start talking about our favorite shows. Professor, I'm keen to understand from you, as we talk about the future of healthcare, what does that look like and feel like for you on a day-to-day basis? What are the new opportunities that are opening up in your day-to-day practices, and what are the challenges that are emerging that you are having to grapple with because of the embracing of the future of health?
Thank you very much. And firstly, thank you very much for having me on the show, and thanks for the very nice question as well. The impact of COVID has been very significant, and working in a pediatric hospital, we've all felt it. We had to make significant changes. These changes predominantly involved service delivery, clinical changes, to make space and to be able to reshift the resources from certain areas to where we would see the impact of COVID. Impact of COVID has been in both terms of having COVID patients coming through the doors of the hospital, but also healthcare workers becoming ill and not having enough staffing to look after those patients. So the two things that has happened is the reduction of the elective surgery, and elective surgery in that concept, we mean anything that can wait more than 3 months, we postpone those operations, and also the outpatients clinics, the patients coming for follow-ups or certain outpatients, we had to reduce. We had to very much limit those services to shift the resources for COVID. But then we ended up having a problem to be able to service those delayed or the cases that could not be done. So here, in terms of the outpatients, when we re-looked at what's happening in between the peaks and how we can remodel the clinical services here, telemedicine obviously came as on top. Telemedicine doesn't really need to be done in a very highly sophisticated infrastructure as well. Just a telephone and telephonic conversation and being able to do follow-ups telephonically is something that has been implemented, and that's functioning very well today. As you said, from the future, we could do today. The other thing is being able to address the patients that should have had the surgery but had to be postponed. That's of course a bigger challenge. And with it in the sort of environment that I'm working at the Red Cross Children's Hospital with the Children's Hospital Trust, with the fundraising initiatives of the Children's Hospital Trust, we have expanded the waiting list surgical initiatives, what we call the Saturday surgeries, and we could extend being able to offer surgery to patients outside the normal working week. The biggest challenge is, of course, when your numbers are so high, how to allocate resources that are now very limited to very needy ones or the ones who would need it first. So as Dr. Wenda mentioned, data is important. Being in an academic setting, we are able to generate data. We know the patient's needs. And perhaps this is where the colleagues from the digital profession, digital systems can collaborate with us and find solutions together to address the needs of these patients that couldn't have been fully addressed during the COVID. Thank you.
Prof, I think it's really an excellent list of opportunities and changes that really sound like they are making a real impact in the communities that you serve. I'm hoping that we're going to get an opportunity to double click on the telemedicine as a predominant trend that we're seeing in your space. But before I do that, let me try and bring on Dr. Jilata Ngumisa, if you're with us. Let's bring this question to you, because as a neurosurgeon, I would imagine that you also have some very unique experiences that have changed and have been influenced by the digitalization and integration of technology in your space. Let's give you an opportunity to talk to us about what are some of those big opportunities and what are some of the challenges that all of this has presented. At this moment, we are not hearing Dr. Jilata, so I'm going to move on in our conversation, and I really want to get into the virtualization of care in South Africa, and I really want to get into some of the specifics around telehealth and AI, and maybe Professor Nomaglu, let's come back to you as a double click on this. Let's look at virtualization, because I know you had already mentioned telemedicine as one of the big trends that you're seeing in your space. How is this impacting? How is virtualization impacting in particular your ability to service your community?
Thank you. I mean, we are already seeing the benefits of it taking place in our community here, and I'll give you a few examples. Being in a clinical setting, burns patients is one very good example. We have a very high burden of disease in the burns disease and patients getting burned. They need to be seen, they need to be managed at centers where the burn care can be provided. But not all patients actually need to be at a center immediately, and decisions can be made by certain applications carrying the images of patients in a secure format to the specialist. And we've implemented this. We've got models that we're using here, and we are able to reduce the number of cases coming to the inpatients coming to the hospital, but the appropriate management, the appropriate treatment is provided to them using the telemedicine. Just one or two other examples of it. Again, in the provincial system, a platform called Hectus has been implemented in the trauma unit and emergency units, generating tremendous amount of data. At a real time, you can identify which hospitals are under load, which hospitals get more capacity, able to follow the patient's journey from the admission to the discharge. Significant benefit, and it's happening today. And perhaps just as a final example, we can use another system that we're using called Hula, where patients are referred again in a secure format, in a secure application to the physicians, to the surgeons, as an emergency referrals from peripheral hospitals. So these are all being implemented, these are all functioning today, benefiting the community that we serve.
Prof, before I move on from here, of course, one of the niggling questions for me is the capacity of our healthcare workers to really run with these technologies. What processes are we seeing coming to the surface to make sure that the talent pool that needs to adopt and run with these technologies actually has the capacity and the know-how to do so? Prof, for some reason,
go
ahead, please, Prof.
What I'm delighted is a number of these technologies are actually developed in-house, locally, in the country here, in the region here, that addresses the problems that we face. But in terms of the human resources capacity, I think one is seeing a shift from being able to just directly seeing the patients, again, in an outpatient setting, to the telemedicine side. It's always difficult, but it is possible. With regards to the infrastructure, as we're experiencing with many other things, in the old days, when we talked about video conferencing, we needed to install expensive equipment in, but today many things can be done from a mobile phone. So that's currently, at least in our setting where you're providing the service, it hasn't been a major challenge.
It certainly is really exciting listening in to how even our healthcare workers are being capacitated through virtualization. And maybe, Dr. Hendwa, let me come to you. And particularly the question is, what opportunity do you see for virtualization to further enable the work of Medicines for Africa? And you're muted, Dr. Hendwa.
Right. So I think, to really be able to benefit from virtualization, it has to start with the digital transformation of patient records and digital transformation of the supply chain information. What we need on the African continent that is already beginning to happen elsewhere is to build the data foundations before we can have the ability to do those complex analyses that can actually help us to be more efficient in our work in terms of understanding what are the medicines that are needed, what quantities, when, how frequently. So the question really is, how do you make medicines consumption data and supply chain data available in a way that it becomes big data, which is a lot of data that you can then use and leverage to digitize the supply chain so that you're able to actually have visibility of what's happening. Once you have that information, it can really help us to bring visibility of what's happening with the patients. What do they need? What works and when do they need it? But also to have visibility when we are moving products, let's say from a factory to a health facility in a rural part in South Africa. You would be able to track using, for example, the Internet of Things, where you have everything connected on the supply chain with temperature sensors that monitors how, the conditions at which your product has been transported and stored, who has received it, with cameras in the warehouse. And when it leaves the warehouse to go to the health facility, you have trucks that have GPS tracking. So you can see on every step of the supply chain where your product is and who is interacting with it, under what conditions. And that can really help us to improve our planning, enable access to make sure that we reduce, because when those processes fail, when we don't have visibility, when we fail to plan appropriately, quite oftentimes the products are late, they're ordered late, and we end up doing emergency purchases, which cost a lot of money because you no longer get fair market value for the product when you are in a hurry. So digitization of that base information would really enable the work of organizations like ours, like Medicines for Africa, to just be able to plan, but also to bring security, because there's a lot of theft and diversion in the African supply chain. A lot of products go missing, they get lost because of that lack of visibility. So digitization, which starts with us making that data available digitally, translating the stacks of paper into digital information, would really enable us to be more efficient, to get better value, to save money within the supply chain when we're buying medicines.
Sure, that's a business case that's pretty compelling if I'm listening to it, Dr. Hendwa. More efficiency, more value, leveraging buying power more effectively, increased security, and all of this starts off with digitizing our supply chains. But as you said, a strong foundation of data management and building data management assets could translate into all of these benefits. Wayne, let me make my way back to you, and I'm particularly wanting to zoom into virtualization and tap into what is exciting you most about what's happening with virtualization in the healthcare sector, and in particular in the context of what's emerging in the future.
So yeah, that's a good question and really, really exciting. I think, moving into a plug and play where human and technology connect for the benefit of individuals. But even looking at not even a plug-in potentially. So I always had this kind of vision of where technology would be. You walk up to a urinal as a gentleman and you have a wee or urinate in the urinal and it says, hi, Wayne, your temperature is currently X. your sleep is, how many hours sleep you had, and maybe your heart rate's a bit tachy and it's time probably to call a GP or a practitioner. And I think, it sounds quite futuristic, but what that'll enable is, imagine in rural and in townships where we could line children up and they could have these tests and go through the kind of the initial stats and see their vitals, and then be able to predict where disease or there would be any issues with individuals that could then be sorted and resolved beforehand. So that's really, really exciting. And then also hospitals on demand. There's also, massive opportunity looking at disrupting hospitals in, booking beds and looking at smart tech around there as well. And then home care, which we've seen so much. So I think the bottom line is, in what, data has been quite a hot topic tonight on this panel conversation, but patients owning their own data, so having control over their data and diagnostics, which is quite exciting for individuals to understand and have a better education around who they are and what their body and how their data is made up of, and being in control of that. And that's really, really exciting moving into the future.
Wayne, if I'm listening to this list, plug and play, reimagining access for rural areas and townships, and in fact that geographic divide just completely collapses. I love the idea of hospitals on demand, and I think it matches beautifully from what we heard from Dr. Hendwa. She's saying to us, learn from the streaming services and how they've been able to curate different experiences almost at an individual level. And of course, what you put now on the table, this idea of patients owning their own data. Well, that's really interesting, because up until this point, we have not really seen that in the healthcare sector. What would need to fundamentally change, Wayne, for that, for patients to really have ownership over their own data, and for that power dynamic to almost be turned on its head? What would have to fundamentally change for that reality to be true?
So there, owning the data, I don't think it's one provider that has all the data. I think there are pockets of data in different providers, insurers. So having that unique ID as an individual, that is the pin that then connects into healthcare provider solutions. So that, if you're going to a hospital, if you're going to just a general practice, if you're going to the gym, that ID is your unique ID. You have control over that. And you don't have to fill in those forms, because so often we're filling in forms that potentially everyone has the data already. We're just recapturing information there. And then having the data visualization, which is really the exciting part for the patients, to look at visualized data and drop and drag and play on that. And we've seen this, and progressively, with smart devices and handheld devices, people are having conversations around how much sleep did you have? Did you have REM sleep, deep sleep? What does that mean? And, so we're seeing behavioral changes that are really adopting these smart technologies, and people becoming more savvy and aware of med tech and medical stats.
That is absolutely excellent. We are becoming increasingly aware of medtech and beginning to own our own data. With that, allow me to wrap up this panel discussion, which certainly has built on the embers of the Fireside Chat that we started off with. A very big thank you tonight to Wayne Zwayers, if I've got your surname right. Wayne Zwayers, he is, of course, the CEO and founder of Basalt Technology. Dr. Lenius Wenda, who joined us, founder of CEO Medicines for Africa. Really interesting insights. Thank you to Professor Alp Nomanoglu, who is, of course, the head of the pediatric surgery at the Red Cross War Memorial Children's Hospital and the University of Cape Town. And an apology from Dr. Ngumisa Jilata, who wasn't able to join us tonight. Now, ladies and gentlemen, we're changing gears once more. We are now turning our focus to the CEO's perspective on the future of healthcare in a post-pandemic world. So let's welcome our next guest.
Fireside Chat, CEO Perspective. The future of healthcare in a post-pandemic world with Vincenzo Ventrancelli, CEO, Philips, Middle East, Turkey and Africa.
It's a big welcome to you, Vincenzo. I know that you are dialing in from Dubai, where it is rather late in the evening right now, so we certainly appreciate you joining us. I understand that you recently visited Johannesburg almost 24 hours ago. Tell us a little bit about your visit, and I'm quite keen to hear about your impression of South Africa.
Hello, good evening, everyone. Yeah, late, but not that late in Dubai. Yes, I've been spending my last weekend in South Africa, in the area of Johannesburg and Pretoria. It's been great from a personal point of view, refreshing to see the powerful nature of South Africa and the blossoming jacaranda. From a professional point of view, it's been great finally to be able to travel, meet my team there, meet healthcare professional, partner and customer, and discuss about all the opportunity that we have in the country at the moment.
Vincenzo, I'm certainly happy that you've seen the purple jacarandas. It's certainly a big highlight for us this time of the year. But maybe let's talk a little bit about the pandemic, because we know that it's prompted a focus on virtual care, especially as it showed its value as a scalable enabler to really help deliver quality care when resources are limited. Well, the question is, what does virtual care in a post-pandemic world really look like, Vincenzo?
Yeah, of course, there was already a set of trends that were moving us towards a virtual and more remote care, but the pandemic has created a clear acceleration. I think that the community across the globe have quickly embraced virtual care and collaboration as a safe and convenient alternative to legacy and standard care of delivery. In parallel, clinician acceptance grew very quickly as collaboration and connectivity from what is say the bedside to website become more the norm. I think patients, healthcare providers and physicians found immediately the benefit in the way technology can link people and places together. And we started seeing the new shape of healthcare. Maybe I can give you some example of what is very hot at the moment when we talk about virtual care that give us a bit of a glimpse into the future of healthcare. So from one side, we see that assisting intensive care team from far away. And there is a kind of solution in the area of telehealth, where specialists, so healthcare professionals, who are in a short supply at the moment, can ensure that specialists can access vital patient data and can collaborate regardless of the location. So, for instance, in an environment like intensive care unit, one of the most critical parts of the hospital, through ICU solution, you can make sure that you have a team of intensivists in a central monitoring facility that in some way act as an air traffic control center and allow for patients to be monitored remotely, and actually to move the most appropriate care setting. So in some way, connecting different ICU within a network, you can have intensivists on one side helping no matter where the other ICU are, and therefore making sure that the quality of care that is delivered also in remote area is up to standard, can activate, can help nurse on the bedside to be more effective, also prioritizing the patient that need to be tracked. So a number of benefit through this telehealth solution. This was an example by ICU. Maybe another one that has become very important during the pandemic. So this screening and engaging with patients remotely, even before they enter the care facility. And I think this has been accelerated by COVID. So call center, we're calling and having questionnaire to monitor suspected coronavirus patient. before referring them to the appropriate care provider. And we think that this trend, we all hope that the pandemic will ease out and will hopefully very soon disappear. I think these type of online screening and engagement tools will continue to spread simply because they are extremely convenient, and then they make sure that the hospitals are not clogged with patients that don't need care. So these are a couple of examples, and I think there are many more. Maybe the last one and also was interesting because I traveled recently to Africa, not only South Africa. I was recently in Egypt and in Kenya, and I found the health professional very sensitive to this new type of solution, both in the private and in the public environment. So another interesting solution is the use of provider-to-provider telehealth that is also increasing. So offering healthcare professional new innovative way to collaborate, even though when they are far apart. For instance, an example is the Radiology Operational Command Center. This is a specific Philips solution, but there are similar ones that enables experts, technologists of imaging to remotely train, guide, and assist maybe less experienced and specialized colleagues in a satellite and dispersed location. This helps to ensure consistent image quality across the different sites, minimizing the need of repeated scan. So also in this case, a number of benefits that in some way are all going into the direction of what we call the quadruple aim. So from one side, virtual care and telehealth are really helping in improving the outcome of healthcare. At the same time, improving the patient experience. So the quality of the care can be very high no matter where you are. Improving staff experience. This is another challenge that the healthcare system is having. And if done in an efficient way, this can also lower the cost of care. So that's a bit of a jump in a future that actually is happening as we speak.
Well, Vincenzo, I think you've really showed us that the future doesn't happen to us. We shape the future. And some of these really practical examples are just a showcase of how exciting the space is right now and the opportunities on the horizon to really just improve the outcomes from the healthcare sector. One of the things, though, that I do want to talk about is how can chronic conditions be managed in this new era of healthcare? A little bit of a comment around chronic conditions, Vincenzo.
Yeah. In some way, one of the challenging chronic conditions is again that healthcare is still a very fragmented area, and managed in general through acute events. Where chronic conditions need a different type of care. But this new digital technology and virtual care that we are talking, I think can effectively deliver a great benefit. So digital technology also in chronic disease through the ability of so big data and patient can we can study the genetic of the patient, and we can customize the approach and the treatment that we can have. So we talk about social data can indicate a personal lifestyle, so the ability to comply with certain treatment plans and other factors that make definitely easier assess certain risk on getting illness and to determine the best personal treatment plan. So in some way, healthcare leaders, including Philips, are very keenly focused on developing virtual care strategy that go beyond the hospital visit. So by exploring what we call condition-centric patient care done outside of the clinical setting. And you also have a set of smart devices that have been developed that continuously monitor the condition of chronic patients and therefore helping in an holistic treatment well beyond the hospital.
Yeah, Vincenzo, that certainly is going to require a mindset shift because one would imagine that the hospital has always been sort of centered as the center of healthcare, and how exciting the new opportunities that open up when we begin to say, well, let's centralize the condition and let's maybe relook at the challenge in a different way. One of the things you've mentioned, though, Vincenzo, is big data. And in the previous panel that we've just had right now, there was a huge focus in that conversation around big data. And in particular, some of the doctors that were on that panel were saying, look, big data is going to be a game changer for the healthcare sector. But in the African context, sometimes we struggle with data management. We don't build the right data assets. And this is a challenge that we're going to have to overcome if we want to really benefit from technology in the healthcare sector. What is your observation, Vincenzo, when it comes to really harnessing big data and building big data assets?
Yeah, I think that the challenge that I see is also beyond Africa. If I look a bit at the geography that is under my scope, but also beyond. So from one side, most of the countries need to develop the proper infrastructure. So healthcare is quite a complex environment. I think more and more when we talk this telehealth solution, improving patient outcomes, and utilization of the new technologies, we need to find a way of collaborate within the healthcare sector, but also beyond. For instance, with telecom providers that are gonna make sure that we have the right infrastructure to allow these data to flow, to be captured in a kind of seamless ways. In that context, I agree with Africa can have a specific challenge. I don't know if the discussion that you had also in the previous with previous panelists and colleagues, I think that there are a number of developments that will help in this direction. So to create a certain infrastructure and the ability to archive, share, and flow this important set of data. One of the important elements I see still in development, it's also the legal framework in order to allow data to flow from one side in a secured way and from the other in a way that makes sure that this powerful technology can be really fully exploited. And let me make maybe some example also here. So many governments are coming with initial cybersecurity, data privacy law that are welcome because, of course, it's important also in healthcare to protect a certain set of sensitive data. At the same time, benefiting of the some of this data being able to flow freely and therefore being benchmarked with a global database will really allow for the powerful development of artificial intelligence algorithm that will help healthcare to move in what we call predictive and preventive healthcare management. Yeah, so an important topic that is very high on the agenda of healthcare providers, but also I think very high on the agenda of government. So I see the opportunity to collaborate in this field and making sure that in a certain time frame, most of this barrier can be overcome.
Vincenzo, it certainly almost sounds like you were a part of that conversation because all of the points you raised certainly came to the fore. In particular, Professor Richard Gordon, who started us off today, was talking about the legal framework that you've just raised now and say we really need to go back and review our governance structures so that we are able to balance, rightfully, as you've said, data protection, but also this ability to archive, to share, and to flow. A beautiful word that you've used there. And of course, this global database opportunity. But as you talk about global databases and AI, I want to bring that as my next question to you, Vincenzo. What impact are technologies such as artificial intelligence, machine learning, blockchain as examples? What impact are they having on healthcare in your opinion? And maybe you might also comment on what are some of the growth areas that you're seeing in the industry as a result of the integration of these technologies?
Yeah. Let me start from the example so we can, I was at the beginning of our conversation, I was talking about this very specific solution called Tele-ICU. So connecting together EICU department within a network of hospital or also beyond the network of hospital and allowing for certain data to flow freely in this global database. The big number that this information can be benchmarked and used will really help in this case to tell us before a patient situation deteriorates that this is going to happen, because a set of critical indicators will tell us that this kind of case is already happened somewhere in some part in the world. And by connecting all these elements, there are high chances, of course, we are talking always about statistical element, there are high chances that this patient is going to deteriorate in the next 6 hours. So in that context, I think that the powerful, it's incredible. And the patient in the ICU department can then therefore prioritized in order to be taken care of. If you think how situations are happening now generally in a department, clinicians and nurses, they spend a similar type of time on different patients based on certain assessment that they have of the condition. This kind of tool supported by machine learning and artificial intelligence will prioritize the patient, will tell them exactly who need to be taken care first, and also what are the kind of intervention. We are not only talking about a dream, so these things are already happening. And also in my region, in Middle East, Turkey, and Africa, we have already in some market started with some of these implementation. So this is one element. So early information, preventive medicine. Another area where the machine learning, artificial intelligence will help is about the personalization of treatment. So that this will really put the patient at the center of care, personalizing their need on treatment. So holistic view of patient genotype and phenotype information can give to the care teams an incredible, strong tool to act correctly. One element that I want to point out is that artificial intelligence, machine learning is very effective into repetitive, routinary task. In this one, the operational efficiency that this new solution will bring will be extremely beneficial to make the system more efficient and less expensive. So one of the critical element of healthcare is that it's very expensive, and government and institutions are struggling with this. By bringing operational efficiency, freeing up time of specialists and nurse to the right task, we expect this will be of a great benefit to the overall ecosystem.
Vincenzo, as you speak about this opportunity to see the whole system being more effective, it's certainly one that is compelling, especially as you talk about, the tele-ICU example, and we see how even nurses become more effective in the decisions around care that they are making. Of course, when you talk about the personalization of care, in the previous conversation, we ended up talking about streaming services and what we can learn from some of those streaming services. For example, like the likes of Netflix, and how they've really been able to curate and personalize the type of content that one begins to see. I suppose the thing that strikes my heart, though, Vincenzo, has to be the point that you're making around cost. Now, we know in South Africa that the cost of healthcare has been the differentiator between those who have access to healthcare and those who don't. I think one of the stats that was used earlier on in the conversation is that in South Africa today, there's only about 17% of the population, that's 1/7, that actually is covered by medical aid or medical insurance, as it's more commonly known. Yep. Let's talk a little bit about that and how telehealth in particular really can address the inequality that is so predominant and prevalent in the South African context. What are some of your thoughts around that?
Yeah, look, this new technology can have a big help also in that. The standardization of the quality of care, the ability to reach remote area in a more effective and efficient way, the ability to help the access to quality care to a bigger number of people around the country is for sure one of the big opportunity that this new technology are giving us. It's also important, in my view, and of course, as Philips, we are looking also at how we can support both governmental institution and private institution in managing their investment. Because to go to this transformation towards telehealth will require a set of investment that goes partly in the technology and partly in the change of way of working of a clinician and physician. So one thing that is going in parallel to the development of virtual care, telehealth, and remote care is also the development of these, let's say, new business model. We talk about moving from capital expenses, so from CapEx element to more OpEx system. So we want to help the different partner or in the ecosystem to have a better cash flow management by supporting the investment with new business model. Let me make some examples. So we are more and more moving, instead of paying immediately for certain big equipment that is required, the payment can be deferred through paper scan, subscription model, pay-per-use, therefore making the transformation and the investment in this new technology in some way more affordable. We know, if we go and zoom a bit into the private area, that a hospital, the first 18 to 2 years of an hospital can be very critical in terms of cash management. If we can help with innovative solution to spread the weight of this financial investment across a longer period, I think this will accelerate the transformation in this new type of solution, and therefore will make sure that this type of benefit that we clearly see will reach a higher part of the population.
It certainly is a very interesting lens on how we might see, more transformed healthcare institutions, but ones that are more sustainable as new business models begin to move and shift, as you say, Vincenzo, from CapEx heavy to more OpEx more OPEX reliance, and that's certainly interesting. I do want to talk about value-based care, Vincenzo, before we move on. And the question really is, what is Philips doing to improve or to encourage value-based care in emerging economies, especially like South Africa?
Yeah, to create the right support system for value-based care models, we are focusing on partnership, on collaboration, on co-creation with our key partners into the ecosystem. This requires a lot of emphasis on things like interoperability. So making sure that the hospitals are fully connected within, but also fully connected within the network of hospitals. It requires standardization. It requires open platform, vendor agnostic solution. And I think that we are quite well advanced in a way that we are managing this. So technology acts as the key to unlock this holistic value-based care. And again, what I like to do is also always try to make some example to make the things more concrete. If I think about sub-Saharan Africa, unfortunately, this is one of the areas with the highest maternal and neonatal mortality rates in the world. So numbers are quite overwhelming about women and child, the newborn that die every year. And the vast majority of these deaths can be prevented with a proper, we say, antenatal delivery and postnatal care service provided by the midwives. So in that context, one of the concrete things that we have done as Philips, we are focused on introducing in the continent, including South Africa, some solution to address this. So we have models in which we train midwives in primary care facilities, and that because we know that they can play an integral role in early detection, diagnosis, and follow-up of pregnancy and pregnancy-related complication, especially in rural areas, underserved communities. And we do this with for instance, telehealth solution supported by, in this case, we talk ultrasound. So these so we have ultrasound that are in some way spread across different rural community. And these allow midwives and clinicians to scan pregnant women in rural areas. And actually, this information are shared through expert clinician in some center area that can immediately give a certain type of support in this way. So that's a program that is active since few years. Supported by Philips commercial team, but also from Philips Foundation, that is our army that is specifically looking at primary care. Maybe another initiative that we have launched again in sub-Saharan Africa, a bit with the same concept. Is the first of a kind mobile intensive care unit. So again, ICU. So designed to meet the critical care requirement of patients. So these solutions are used by government agency system to rapidly increase the ICU capacity within the community to mitigate the impact of natural disaster or pandemic. So in a moment of acute crisis, you can deploy very quickly and you can increase the number of the ICU that can be so critical, as we all saw during the COVID pandemic. So these are some of the examples of things that we are doing, trying to move from legacy type of care to more value-based care, and also a care that is starting from access to care and primary care with great benefits to the rest of the system.
Well, Vincenzo, it certainly sounds that like the way Philips is encouraging values-based care is by doing and investing. So it's not just about talking. And so listening to this mobile ICU example, but also, of course, the interventions that you're doing in maternal mortality. One, of course, as you've said, one of the biggest development outcomes that we need to change in the African context, and especially in sub-Saharan Africa, as you've indicated. We've almost come to the end of our conversation, Vincenzo, so I'm going to try and sneak in one more question. You know, having listened to the conversations that preceded you, the conversation that I've just had with you now, it's very clear that virtual care is here to stay. But what does the future of healthcare look like? If I can get your soundbite on that, I'd be happy with this conversation. What does the future of healthcare look like, Vincenzo?
So I think that the pandemic have forced the health system and innovators in this area to rapidly pivot and adapt, in some way resulting in what experts say a jump of around 10 years in progresses in only few months. So telehealth to virtual care. So this is really the dream of connected care is in becoming, and I think also during my trip in the continent, since I've been able to travel, I really have seen how government, private institutions are much more receptive to this kind of solution. They still want to have cutting-edge technology in the usual modality that they know, but they understand that the real value it's in this type of solution. There has also been a realization where the involvement of government in healthcare remain pivotal. So collaboration between private and public is extremely important. And while privatization, like happen in many areas in the world, has shown the weakness of these kind of systems. So a balance between how the government are acting and how the private are investing, it's really required. I think we all experience that if healthcare is not well managed, everything literally stops. And I think this has been a kind of eye-opener for the system. So in some way, I'm very positive about the development that I have seen. Connected care has accelerated a number of trends that were existing, but now are really reshaping in a dramatical way the healthcare system. So the concept of a network healthcare system, I think, is clear and has become evident. The acceleration of telehealth and virtual care and remote guidance is another trend that is there to stay. The increase in consumer engagement, in patient and consumer of their own health and the one of their families, is one of the other trends that is clear and there to stay, shaping the future of healthcare. So as a global healthcare leader technology that proudly recently celebrate 130 years of innovation and collaboration, we are very excited to co-create the future of healthcare as we are doing as we speak, bringing together solutions that have the power to transform care to a precision, outcome-based practices that in the end are going to improve the lives and experience of millions of people across community and across our beautiful continent.
Vincenzo, it's beautifully said. The dream of connected care is here, and Philips is helping to co-create that every single day. It's a very big thank you to Vincenzo Ventricelli. He is, of course, the CEO of Philips Middle East, Turkey and Africa. Thank you so much, Vincenzo, for joining us. That, ladies and gentlemen, brings us to the end of our 2 days together. This at the 6th annual Future of Health Summit in association with Forbes Africa and Philips. Now, every year comes with a different theme based on the findings of the Philips Future of Health Index. The theme for the last 2 days has been looking at beyond the crisis, how healthcare leaders can learn from the past to build a resilient future. And we've certainly had several lively fireside chats and panel discussions. And so a very big thank you to you, our webinar audience, for your interest, and to all of the participants over the past 2 days. From myself, Nozipho Shabalala, and the team at Forbes Africa and Philips, the ABN Group as well, thank you so much for watching. Have a lovely evening.